I'm going to look at an article written in 1973 in the Singapore Medical Journal about a method of abortion called the intra-amniotic injection of prostaglandins. So this method of abortion was used for mid-trimester pregnancy, here at 12 to 24 weeks. So if you want to end a pregnancy in this time, there are certain specific challenges. Because the uterus is quite big, you cannot form a curettage, which means to just scrape inside. Hysterectomy would involve something like a C-section, but very small. So what they did in this study is to inject a strong saline or glucose solution into the amniotic sac. So that means like just, straight into the abdomen of the mother. And they said that, even though it works well, sometimes there were very serious side effects, such as dangerously high sodium levels and infections inside the uterus and even deaths of the mother. So this study was trying to find out how effective and safe it is to use prostaglandins injected into the amniotic sac. So of the 10 cases, 3 were aborted after the first dose, 4 after the second dose, and 3 cases actually failed to abort even after 3 doses. And they don't say what happened to these 3 cases, so perhaps the mother still had the baby, but we don't know what was the effect of these injections of saline and glucose into the amniotic sac. What was the effect on the baby for the rest of the pregnancy? The average time taken was 14 hours, with the shortest being 6 hours and the longest was 35 hours. So they concluded that these 2 types of prostaglandins were effective, with a success rate of 86%. So what happened to the 14%? The main disadvantage of doing this method was that most of the abortions were incomplete. So they still had to do curettage or scrape out whatever tissues were left. And it's, of course, very dangerous if you leave behind any piece of the placenta or sac. This can cause hemorrhage and infection for the mother, and she can also get really sick or die from it. So I was looking and I found this article from 2005, and here are all the obstetricians that currently work in a public hospital in Singapore. And in this study, 132 women who were also between 12 and 24 weeks gestation who sought abortion in this hospital. And they had been randomized to receive either vaginal misoprostol, or is an off-label use for the drug. However, under Singapore law, it is approved abortion. So either this drug or intra-amniotic PGF2 alpha, which is the same thing as in that first study from 1973, direct injection of prostaglandin into the amniotic sac, into the belly of the mother. The results found that both methods worked equally well. The percentage of women who completed the abortion between 24 or 48 hours was not significantly different. They found that misoprostol worked faster. On average, it took 16 hours. The injection of prostaglandin took 20 hours. And they found that misoprostol worked faster in women who had given birth before and who also earlier in their second trimester, so about 4 months. Some side effects such as fever and shivering. So they concluded that they should actually use misoprostol for mid-trimester abortion because it's faster and easier to administer, and it avoids the invasive procedure of injecting prostaglandins into the amniotic sac. However, in the study, they also did not mention anything about what happened to the women who received the injection of prostaglandin, whether there were any side effects or complications that happened to them. That's all for this short video. See you in the next one.